Assalamu alaikum, everyone. Good morning, good afternoon, good evening, no matter which part of the world you are in or whichever time zone you find yourself. Let me warmly welcome you to this webinar organized by the World Forum for Sri Lankan Muslims. Allow me to begin by introducing to you the chairman of the World Forum for Sri Lankan Muslims, Mr. Rizwan Wahab, to welcome you all.
Assalamu alaikum, members of the World Forum around the world, eminent speakers, all participants, brothers and sisters, ladies and gentlemen. I take this opportunity to warmly welcome all of you for the 4th annual conference of World Forum for Sri Lankan Muslims. The conference, as usual, this year is taking place virtually. Normally, World Forum conferences every other year takes place in different part of the world where our members are domiciled. This conference brings you a cross-section of professional and intellectual from around all parts of the world. The theme of this year's conference, Be Prepared and Look Wide, wisely chosen. This reminds me of my memories of early life when I was a Boy Scout, where Be Prepared was one of our motto, which teaches us to be prepared all the time, whatever little things we do, whether it is a project or an activity or a camping out. It is a preparation that we do to ensure our activities goes without any hindrance. Look wide, which is another part of our motto when you become a senior, looking around what is around our world, learning about our neighborhood, learning our community, and how best that we can get involved and serve our community. Now, as for our World Forum, we are in a bigger picture now. According to Benjamin Franklin, failing to prepare, you are preparing to fail. This is because when goals are not set in life, the prospect of success tend to slim. Today, being prepared for World Forum is bigger and wider challenges since the world has changed. With many challenges that we face in the world today, with wars, conflicts, disasters, poverty, climate crisis, our responsibility as a world organization to be ready and to be prepared at all times. How much that we can do and how we can reach to our communities and community at large with our resources for a happier and a contented human society. Being prepared brings better results and to face opportunities and challenges ahead with confidence. Preparing for disaster management, humanitarian assistance activities in the war zone and conflict zone, being prepared for peace, building and resolution, which is something that World Forum we to be aware of, to be prepared and to be in preparedness. Preparation is crucial and we should always be preparing for events in life. I'm trying to be a bit more short and try and come back, try and talk a little bit about look wide. Look wide is something that I explained to you earlier, that if you don't look around you, what is around you, you may not be able to understand and fathom what you are supposed to do. Look wide means to open your eyes and senses and look at the wider world, to inculcate and imbibe and instill yourself the value of human created by the Creator. see and feel in confidence your responsibilities to your fellow citizen, your community, and community at large. Looking wide is very important, each one of you, for World Forum members, so that you are able to understand the world around you, so that you are ready and be prepared to serve our community and community at large. By this, I will conclude and sum up the preparation, and to look wide is crucial to the life of all of us. Thank you very much. The full report on Be Prepared and Look Wide is going to be in our website. Whenever you have time, please read through. Due to time constraint, I'm handing over this to the moderator, Tassi Dahalan. Thank you very much for listening. Assalamu alaikum warahmatullahi wabarakatuh.
Thank you very much, Mr. Wahab. That was a wonderful introduction to today's webinar. I think we have a few new participants here. For their benefit, allow me to share a very brief synopsis of who the World Forum for Sri Lankan Muslims is. The World Forum for Sri Lankan Muslims was founded in 2019, a registered organization in the United Kingdom. Our head office is in London, and we have chapter offices in Melbourne and Toronto. We have members in 27 different countries and 6 continents, alhamdulillah. Our objective is to support Sri Lanka's development into a nation that will be beneficent to society in general and Muslims in particular. We also endeavor to unite and serve the Sri Lankan Muslims who reside globally and act as a global voice for unity and coexistence. Our voice will not remain silent to speak against injustices and fundamental rights violations of all Sri Lankans. We carry out a number of worthy projects in Sri Lanka and around the world. These relate to education, climate change, health, gender equality, and more. We are now in 27 countries worldwide, mashallah. So moving swiftly on, let me explain the proceedings of this conference, just a few housekeeping rules. We have 2 very inspirational and motivational speakers coming up. Please listen carefully to their presentations. I know both these gentlemen personally, and I've experienced their eloquent and enlightening contributions to our world time and time again, and I'm waiting eagerly to hear what they have to say today. Following on from their presentations, there will be a question and answer session after the 2 speakers have completed their speeches. There will be no interruptions whilst the presentations are being made, and everybody will be on mute mode. Once the question and answer session begins, there are 3 ways you may ask your question. You may type your questions in the chat box throughout the presentations. You may send them directly to me in private, or you may raise your hand and you will be unmuted to ask your question. Please do remember that your question should only be relevant to the topics discussed today. Okay, that's enough from me. Without any further delay, let me introduce to you our first speaker of the conference, Mr. Rasheen Bappu, speaking on the very relevant topic, protecting youth from violent extremism and the narcotic menace. Professor Rasheen Bappu is an anthropologist and intelligence data scientist. His interest is in peace building, international relations, international security, cybersecurity, supply chain, and marketing management. At present, he is an adjunct professor to the University of Murdoch in Perth. He's attached to the Institute of National Security Studies, Defence Command and Staff College, and the National Defence College in Sri Lanka. He's a fellow of UNESCO and UNODC for prevention and countering crime, extremism, and terrorism, covering Asian and Middle Eastern countries. He's also a columnist in the Ceylon Today newspaper. Professor Rasheen Bappu holds dual PhDs from Australia and Malaysia. Over to you, Professor.
Assalamu alaikum wa rahmatullahi wa barakatuh. Hope you can hear me.
Yes, you're very clear.
Okay. Thank you very much, Tassi, for your brief introduction. Anyway, I will not take much of your time. I'll get on to the subject. And before I start this, this is not a lecture, actually. This is a thought-provoking session. What we expect from this is basically for us to embark on different projects where the current situation in Sri Lanka is concerned. So we have been embarking on different projects actually in the past. I think we should focus ourselves in these two projects also, which I will just elaborate what is required to be done. Thank you. Right. As you know, I mean, prevention, countering violent extremism. It is a global framework. When I say extremism, people sometimes, they misunderstand. When I say, extremism, basically in religion, you can be extremely knowledgeable. You can go to whatever extent you could, and it is not a, I would say, a punishable offense. As long as you don't go, beyond the boundary of, violence. Where violent extremism is concerned, it is a punishable offense. So you must know where to draw the line, actually. So, UN and UN incorporated bodies, UNODC, as well as UNESCO have been, talking about this subject, and quite a lot of modules have been developed, training sessions have been done, and we'll have to learn from those, experiences and case studies. So prevention and countering violent extremism is a commitment by all of us. And it is an obligation also under the principles and values enshrined in the Charter of the United Nations, the Universal Declaration of Human Rights, and other international human rights instruments. This is a snapshot basically about the work plan of UNESCO. Anyway, I will go into detail on UNODC, which is also very similar. These are the drivers of violent extremism. There are push factors and pull factors. If you take the push factors, lack of socio-economic opportunities, marginalization and discrimination, poor governance, violation of human rights, and the rule of law. Prolonged and unresolved conflicts, de-radicalization in prisons. So these are the push factors towards violent extremism. Some of the pull factors are basically the psychological ones that can render an individual more susceptible to undertaking violent extremist behavior. The individual motivations and processes, which play a key role in transforming ideas and grievances into violent extremist actions. These include individual backgrounds and motivations, collective grievances and victimizations stemming from domination, oppression, subjugation, or foreign intervention, distortion, and misuse of beliefs, political ideologies, and ethnic and cultural differences, and leadership and social networks. So it's a broad area. So when you take, different violent extremism, is are there actually. Now, our focus basically is in religious violent extremism. Definition of religious violence extremism is as a motivation for terrorism is that extremism comprises ideological beliefs about an obligation to bring back a political system to form suggested by religious norms through violence. So this is the definition which has been given. When you look at, I think you will find this in the Presidential Commission of Inquiry report also, but this is a bit of a modification which I have done from my school of thought. People don't, become terrorists all of a sudden. There is a gradual, approach for this, and which is called the staircase approach. First, we see, exclusivism is being practiced. People are confined to a, certain ideology within themselves, and they go on preaching about it, doing activities on this, and they get into the extremism stage. The second stage is extremism. From there onwards, they move on to radicalization. So 1, 2, 3, exclusivism, extremism, radicalization are stages where the civil society can get involved and monitor and take appropriate action to de-radicalize. Once you pass this stage, then you move on to the next stage, which is violent extremism. And they move on after that from there to the 5th stage of terrorism. So the 4th and the 5th stage, civil society has nothing to do with this. right? Our responsibilities basically as a civil society is gone basically. Then fourth and fifth stage will be taken care by the security authorities actually, or law and order authorities. So we have a pivotal role basically to play in 1, 2, 3, and as much as possible to, de-radicalize or to, make them understand and teach them what is correct actually and what is wrong. And this is very common basically, not only for, this is extremism in religion basically is there with all the religions at the moment. But Muslims are noted basically because of, certain things which we have, as a whole ummah, we'll have to take our responsibilities basically to, curtail these things going out of hand. As you know, UNIDO, developed South Asian Network for Prevention of Violent Extremism. So in the South Asian Network for Prevention of Violent Extremism in Sri Lanka, we have 3 focal points. One is the Ministry of Defense, Ministry of Foreign Affairs, and Ministry of Justice. So there are quite a lot of, areas which they have undertaken. But there's quite a lot basically where civil society can get in. And when it comes to the thematic group of education, we have to have the thematic group of education, basically, a working group, where we can strengthen skills of teachers, educators, and other relevant practitioners to detect and prevent violent extremism processes leading to terrorism in the field of education with a particular focus on children and youth. And the other area is basically the strategic area. The narratives, which we call it a strategic communication and narratives group, where you can focus on these, it is basically most efficient alternative and counter narratives to prevent violent extremism leading to terrorism in South Asia. Then the other group is basically about the civil society organizations where they can come together, and the civil society and local communities. This is the third thematic group which we are talking about. And the civil society and local community thematic group is aimed at encouraging the engagement of civil society organizations, community-based organizations, local leaders, youth and women organizations in the development of prevention of violent extremism initiatives, strengthening their skills and ensuring a whole of society approach focused on the local needs and priorities and actors. So these are basically 3 thematic groups we can think of to work on. And you need basically, when it comes to strategic and communication, now the communications have changed from the conventional communication to the social medias. So we can use social medias at a very, very low cost in terms of, addressing this issue. So quite a lot of other countries have done it, actually. The closest country is basically Maldives. They have a wonderful model. And even I think some of these Islamic states also, they have their own models actually which work on. So we can also look at these, models to, look at. So way forward, we are looking at forming a project team to address this, impart knowledge and extend your social responsibility towards national harmony and security, develop harmony, interfaith centers, forums, and clubs. Apparently, a couple of organizations have come forward. Even I have also written an article actually on this in the Ceylon today of the organizations which have voluntarily come forward and done it. And we have more work to be done. And we cannot, be satisfied with what is being done at the moment. So for in-depth information, you can go and Google some of these articles which have written on these areas also. Okay, the other area is basically about the narcotic menace. So is another challenge for the community, but especially many Muslim community leaders have not bothered to focus in this area because our focus is to put up mosques. Our focus is to beautify the mosque and add amenities. And we are worried about, structures, So we have structures, enough structures. I think it is high time for us to use these structures for the benefit of our ummah. You must go and see you must visit suburban and the, urban areas where how Muslim community is affected, along with the other, religious communities, ethnicities. So there are quite a lot of information which I would like to share basically. And this is the annual, so anyway, I think I cannot get on this. There are quite a lot of informations basically in the National Dangerous Drugs and Narcotic Bureau website, which I was trying to share, and it is not the web is not working here. I cannot get it linked. Otherwise, we can always share after this session also, which you can distribute among yourself and see the needs actually, and you can look at the potential what we should be doing, and let us work together basically, and on this area. Oops. Whereas narcotic prevention for consumers, as you know, there are quite a lot of consumers within the community. We'll have to, see that there are two parts in narcotic, arresting narcotic prevention and countering. Now, the authorities basically are working on a different level, and whereas civil society will have to work on a different, approach. Our focus has to be educating the consumers, educating the, the families, and looking at a rehabilitation program and so on and so forth. I just wanted to anyway share. Very unfortunately, I cannot get into this, statistics. Just to see how best I could. Please, I will just try to share.
Is there anyone from the tech team who can assist Professor Rasheen?
No, wait, I will just get it from my screen. That should be okay. Okay, now I'm trying to share. Can you see basically? This is the Tassie. Are you clear?
Yes, we can see. Yes.
You can see, right? Okay. Now this is basically from the research division of National Dangerous Drugs and National Dangerous Drug Control Board. Actually, I have invited Brother Rashad also, who is who has hands-on ground, information. He will also contribute after this, after my talk. You can see basically how, it is been distributed, the treatments, Now we have three areas: the BCGR, Bureau of Commissioner General of Rehabilitation. Then the prison is doing some work, and Narcotic Board is doing some work. There are some NGOs, about 16% of NGOs. So 42% is handled by BCGR, 3% is by, in prisons, and the board is, handling 38% of the whole treatment, effort. So there is a huge vacuum because government also cannot take enough, pressure, because government has main centers in Kandakadua, and it's a huge, operation. And I have got quite a lot of calls even from the Muslim community, where they are trying to basically send them to a treatment, facility, where 5 times prayers can be observed, when they have fasting, where they can have the fast, they can observe the fasting, and the Ramadan can be celebrated. All these things basically is not even BCGR does it to a certain extent, according to their within their purview. But we need to have our own facilities also, where government is planning to extend the opportunities to the Muslim community as well. And because they have no access for Quran, they have no access for books, they have no access for Kutubah, they have no access for basically sermons. So all these things have to be done. Technically certain counseling, certain things have been done to a very great extent, But whereas religious component also has to come in. So this is the belief of the government actually, where religion needs to be taught. The right religion has to be taught basically to these guys. Otherwise, these are going to be a burden for the society and Sri Lankan, community as a Sri Lanka as a whole. So these are basically some of these areas where how treatments have been, how these consumers have been spread and how they have reported, especially in areas like Gampaha, Kalambu, Kurnagala, Gaul. This is where we get people, and you have seen. You can see how this. How psychological effects have been. How they are psychologically disturbed, right? And so I will share this anyway with this. So, and there's another slide which another graph you can see about the age distribution, right? So most of them are in the age group of 20 to 24, 25 to 29 is very high, 30 to 34. You can see this, in green, blue, right? So most of them are in the age group of 25 to 29, right? And if I were to talk about the ethnicities, right? So you can see basically, and this is only people are reporting for treatment. And there are quite a lot of people, the youth, they are not reporting for treatment. They're just consuming and the family cannot do anything. And some of these married, people, they end up in divorces and the children, they don't have a proper, education, and they don't have a proper, plan, and the entire, the community collapses, with this, drug menace. So it is a serious problem which we are facing at the moment. I think, World Forum, as a project can take up this and we can guide. And brother Rashad basically also can be a useful, a resource person. And he's a qualified, basically, UNESCO and a UNIDO person on these aspects. And you can see how it is spread, in terms of ethnicities. The number is low because our people are not, reporting, the Muslim community. Because the Buddhists, through their temples, through their, societies, associations, they are being directed actually, right? So our number is less, and we are, within the community, we have quite a lot of people which suffering basically without any proper solution. So there are, if you look at from their professions, fishermen, businessmen, right, carpenters, right, all these, categories, when they get used to this narcotic menace, right, and there's no end to it, and it has a ripple effect. And whereas, the whole family network gets disturbed, and this is going to be another, what do you call, even in the West, we see, quite a lot of, even in US, we see quite a lot of cities which, they are affected very badly. And unless and otherwise, the civil society and organizations like, the World Forum takes up this as a serious project and does it actually. And thank you very much. And I just wanted to show some of these facilities, what we have in Sri Lanka, basically. This is in Talangama. These are all small facilities, but we can have similar facilities. Even if you all come forward, Teradenia, and this is Nitambua, right, in Gaul. So, okay, so this is a research report, basically, which I wanted to share from the Research and Division of National Dangerous Drugs Control Board. Thank you very much.
Thank you very much, Professor Rasheen, for that excellent insight into two very important and relevant topics facing Sri Lankans today. The big takeaway from your presentation for me is that I'm hearing you say that this has to be a collective effort, right? With the civil society, with our local community, with the youth, with the families. I think a lot of us are in denial, isn't it, in Sri Lanka, that this problem even exists, because we don't go into the areas that are, the problem areas. And I think as a society, our Muslim community is very reactive rather than proactive. So I love the idea that the World Forum is going to take this on, and hopefully we will set up committees that could work on both these areas. Thank you very much, Professor Rasheen. We are also privileged to have with us today MMGBM Rashad, who is the North and Eastern Province Coordinator for the National Dangerous Drugs Control Board. He would like to address us for a couple of minutes about the ground situation in Sri Lanka. Mr. Rashad, I'll give you 3 minutes.
Yes, of course. Jazakallah khairan and assalamu alaikum wa rahmatullahi wa barakatuhu. And I'm Rashad. Actually, I'm working for National Dangerous Drug Control Board as the Northern Eastern Province Coordinator. And I'm an international certified addiction professional as well. So as a person who is working in the ground level and as a one and only person who is working in the ground level as a Muslim in Sri Lanka, I do face a lot of problems and a lot of issues that comes to me from the community where our involvement is very much required. Especially when it's come to drug prevention, it comes three types. One is universal prevention, selective prevention, and indicated prevention. So in treatment, we are talking about the indicated prevention. So anything which we are doing, which we are implementing, it should be evidence-based. Then only we can succeed on that particular projects. Where in Sri Lanka, there are some associations who is involved in drug prevention programs where they are not evidence-based. They are still doing the practice of the old ancient practice where it's not matching to the present world or present community. Especially when we take the official report of NDDCP, in 2019, the survey report shows 519,000 people who is addicted for these illegal drugs. But where after this pandemic situation, the trends of drug usage has been turned. That means in 2018, there were no cases of ice usage. Methamphetamine usage has been reported. But in 2022, I think it's more than 3,000 cases reported about the ice. That means it shows a total shift on the trend of drug using, and those drugs are very much effective to the people where mentally as well as physically. So especially Dr. Ruvaiz Bappu, he mentioned on his presentation where most of the youth are involved in this. So we do have the details of the people who have been arrested as Muslims in Sri Lanka for this drug menace, and the people who got the chance of entering to the treatment facility. If we take 2022, the year 2022, there were around 26,851 arrests about the illegal drugs, where out of that 1,623 of them are Muslims. But when we take the opportunity of treatment, only 112 Muslims have been took treatment for the whole year of 2022 in treatment centers for the drug menace or drug problems. So, and if you take 2021, there are 18,658 number of arrests happened in Sri Lanka for illegal drugs. Out of that, 1,574 Muslims are there, but only the people who took treatment is only 103. So that means there is a big gap, big bridge has to be done between the drug menace and the treatment facility. Same as Dr. Bappu mentions, Dr. Ruvaiz Bappu mentioned. So there are clear gaps between the expectation of these people and the service providing in Sri Lanka, because especially when it's there are around 13 NGO sector, that means private sector treatment centers available in Sri Lanka. Most of those centers are dominated by the Christian priests. So therefore, if we take the Christian people who is getting into the treatment in 2022, the arrest of Christian people, there were only 38 Christians have been arrested for drug menace, where 266 numbers have been got the opportunity of getting the treatment. In 2021, 35 Christians have been arrested for the drug menace, but where 233 numbers of the people they have took the treatment because of this availability of private treatment centers under their priests. So they are trusting them and they are sending them for treatment. But unfortunately, even we don't have a single facility in Sri Lanka which is owned by the Muslims or which is run under Muslim cultural situation. So therefore, it's a timely requirement in Sri Lanka. And as a professional who's working in addiction side, it's very clear there are enough of youths available in our community who have been get trouble because of this drug usage and who wanted to come out from that with treatment. They are willing to come, but unfortunately because of these problems they are not coming out for treatment and still they are using the drugs. So it's a clear problem. That means it is going to be a vicious cycle in the community if we leave this problem as it is. Definitely after another decade of time, I think we won't be able to find a Muslim or a Muslim youth who is not using drugs. So that will be the situation if we not take proper actions as a collective Muslims in this case. So therefore, I'm ready to extend my support as a professional in Sri Lanka, and it's the time, actually it's the best time to open a center, open a treatment facility which we can provide service under Islamic base, Islamic background to our community, to get out them from the trouble. I think so. So I'm not going to take much of time from this. So thank you very much for this opportunity, Dr. Razin Bappu. Jazakallah khair.
Thank you,
Mr. Rashid,
Rashad.
I hope you will stay online in case there are any questions later on.
Yes.
If anybody would
Sure,
like to
sure.
speak to you about that. All right, thank you very much. So it looks like time is of the essence, and we really need to set up these centers to help our Muslim youth. So moving swiftly on, our next speaker today is an eminent doctor by profession and will be addressing us on the topic health without wealth. Dr.Ruvaiz Haniffa, MBBS, DFM, PG DIP, MSc, MD, FCCP, MRCGP, wonderful accolades there for Dr. Ruvaiz Haniffa. He's a consultant family physician and the founder head of the Department of Family Medicine, Faculty of Medicine, University of Colombo. He was a member of the University Grants Commission of Sri Lanka from 2015 to 2019 and is a past president of the Sri Lanka Medical Association 2018. Dr. Haniffa obtained his MD in family medicine, being placed first by merit and awarded the gold medal from PGIM, University of Colombo in 2011. He's a member of the Royal College of General Practitioners, UK, and is also an examiner for the MRCGP international examinations. He has and is serving on committees in primary health and public health of the Ministry of Health Sri Lanka, the Sri Lanka Medical Association, and the Colleges of General Practitioners, Community Physicians of Sri Lanka, and international donor agencies. In 2019, he served as a member of the committee appointed by the Ministry of Muslim Religious and Cultural Affairs to draft an act of parliament to regulate and ensure the quality of madrasa education in Sri Lanka. At the University Grants Commission, Dr. Haniffa chaired the Standing Committee on Library and Information Science, Standing Committees on Indigenous Medicine, and was the founder chair of the Committee on Allied Health Sciences. Dr. Ruvaiz, enlighten us with your presentation, sir.
Many thanks, Tassie, for that kind introduction, and I thank the World Forum of Sri Lankan Muslims for this opportunity. I'm afraid my lecture is not going to be very technical, but a very conceptual one, in keeping with your theme, which is prepared to be prepared and look wide. I don't think there is a better theme to deal with the two most universal subjects, which you have to be prepared and look wide, which is health and wealth. Right, with those words, please assure that I am very conscious of time here. I wonder why you can see my presentation, right? I'm unable to move it. I wonder. Okay,
yes,
right. So I come from a background of rather, though I'm involved in a lot of social science activities, come from a background of hardcore science. Therefore, let me remind you that medicine is a matter of science, and scientific advances become medical progress only when they reach the people who need them most. That is the reason why I'm saying this. You'll see it in a minute, and why I'm telling you, this audience, this particular fact. Okay, so medicine also is not only a matter of science, but a matter of geography and justice. You in the Western world, I think you're in Canada, UK, and all the other developed world, so you will be probably seeing robotics and AI a lot. But we in Sri Lanka have issues of access to health impeding us, such as neglect, distance, governance, prejudice, and fixed ideas of what is possible. I thought I'll also mention this to you. It should not be, that is, medicine should not be a matter of politics and injustice. We Sri Lankan Muslims were victims to a weaponized, unscientific health policies during the COVID pandemic, for which I'm extremely grateful to the World Forum of Sri Lankan Muslims and the entire Sri Lankan Muslim diaspora, who used your good officers to change this unscientific political decision and reversed the decision of back to burial. So this was one instance where I think you could be proud of yourselves, where you played a huge role in helping us in Sri Lanka overcome this unscientific political decision. This is a snapshot of the health structure in Sri Lanka. As you will see, this is the 2015 data, but let me assure you that this is correct in the context of mass migration of doctors out of the country in the past 2 years. I'll just show you trends of hospital admission because this has a bearing on wealth. As you can see, these are the OPD treatments. These are the inward treatments. Please note that these are state figures. Private sector is so minute in Sri Lanka that this government doesn't even count them. So this is the same thing, giving you the precise numbers. What I want to get to is this. Right. So we have about 6 million hospitals admission a year, with about 54 million OPD state visits and about 46 million private sector hospital visits. This year, 25% of the state sector admission went up by 25%. State sector OPD visits went up by 42%. Private sector OPD visits went down by 10 to 15%. As when I say private sector, you will understand that you have to pay for treatment. So these numbers translate into 6 million, 25 is about 150,000, 54 million, 42% is about 23 million. That's the entire population of Sri Lanka going to the OPD once during the first 8 months of this year. And this went down by about between 4 to 7 million visits per year. So just to show you that growth in the health seeking behavior, and also to tell you that in Sri Lanka, healthcare is not delivered in hospitals or wards. It's delivered in an ambulatory setting. So we have this data, and our colleagues in the health ministry, planning ministry, finance ministry, all know about this data. So the consequences of not using data for health planning is that the Sri Lankan health system, both state and private, is designed and maintained by health professionals for health professionals. I'm sad to say it's led by doctors. The health system ought to be designed and maintained to address health first and disease second, needs of the people, and not vice versa. Until and otherwise we correct this mindset in health planning, what I mean is we in Sri Lanka will not be able to provide health care and disease care to our patients in an equitable manner. This has led to this, I think this slide summarizes it very well. We have equal health services because we have wards, we have OPDs, and we expect people to come into this uniform system and get health care, or rather disease care. I don't think anybody comes to hospitals to get health care, they come to get disease care. That again is conceptually a huge problem for us because doctors are associated with disease and not with health. So what we need to do is to build this up. We need to take care of the small guy. How you do that is by promoting equity in health. So that's where wealth comes into the game. So this is just a snapshot of the region. I have taken Sri Lanka, Thailand, UK, some high-income countries, just to show you that we are quite good. In fact, in our infant mortality rates, maternal mortality rates are quite comparable. But what I want to point out is, look at the cost of health. It's very low. This is, I think this stage $151, whereas say in Sweden it's $6,000. And in Thailand, it's $228 per capita. But you might be very impressed by this. But for example, what will be a salary of a doctor in the UK and a doctor salary in Sri Lanka? So actually, though we say we are spending little for health, that is because we are highly underpaid. Our health professionals are highly underpaid. I know I'm saying a very controversial thing because education is free in Sri Lanka. And then, therefore, you are supposed to not get paid that much. But that's not the way if you are going for quality healthcare. You must need a first world mindset if you want first quality care. And also, this is the state sector. Government spends about 3.5%. balance is out of pocket. This figure is for 2018. This has gone up to 51% now, which I think I'll show you in a moment. Right, so these are new figures. Population in catastrophic health spending, that is when you spend more than 10% of your total income on health, that is called catastrophic. Impoverishing is when you spend all your wealth on health so that you have nothing else left. This figure is far high now. We don't have data. 3.8, like I told you, and 40%, 50% is out of pocket. So therefore, we say Sri Lanka has a free health system. It is not true. We have a 50-50 system where even if you go to a hospital, state hospital, most of the time you'll end up paying. So these data comes from a famous study which is done every 3 years. I'll just skip that and show you what you need to see. This is the catastrophic health spending. If you have a chronic disease, which 20% of the Sri Lankan population has, you are in catastrophic health spending. If you have an elderly person in your family, that is somebody over 65 years, very close to catastrophic health spending. Add to an elderly person and a chronic disease person, then you are way beyond catastrophic health spending. Contrary to that, if you have a child in your family, you will never end up with catastrophic health spending because children don't tend to get sick as elderly or people with chronic disease. So why am I showing you this? Because of this. We have a rapidly aging population, and we know that non-communicable disease such as diabetes, blood pressure, and cancers are going to go up. And we are going to face a huge problem in a few years. So these are the mortality figures. As you can see, people, this is comparable with developed countries. Cancers, diabetes, cardiovascular disease, accidents are the main killers. Morbidity and mortality both are based on them. Right. So, ladies and gentlemen, I think this slide will interest you greatly. This is why I thought when Mr. Wahab spoke to me that I'll speak to you on this topic. If you have diabetes and pressure, I have cholesterol, which you always have, we will probably use 5 drugs. So these are the 5 drugs. They are taken daily. Some are taken 3 times a day. These are the cost of these drugs. So in 2019, 2020, you were spending around 3,000 rupees per month for these 5 drugs. Now, ladies and gentlemen, you have to spend 7,000 rupees. And please be assured, this is not due to the dollar variation or anything like that, right? This is due to pure governance and inefficiency issues within the health system. So now you are paying 7,029 rupees per month. So if you have a mother and father who are have diabetes and blood pressure, it's about 14 to 15,000 rupees for these basic drugs alone. So this is having a huge influence on those health-seeking behavior patterns I showed you earlier. So these have enormous consequences. In the short term, it will affect the health-seeking behavior. Like I told you, people are not going to the private sector. They are going to a state sector, which is overcrowded and doesn't give quality care. For example, if you go to the OPD, the OPD physicians, the doctors there are not properly trained to provide outpatient or what we call ambulatory curative care. So there, again, it's a huge problem. In the medium term, the compliance issues, for example, when we ask patients to take, say, for example, a diabetic drug, metformin, 3 times a day, they will tell you, sir, we can't take it 3 times a day. Can we take it once a day, or perhaps even take it every other day? So these are huge issues we are facing, and that leads to what you call long-term issues. So basically now we are asking the government, give us 7,000 rupees to treat these long-term chronic illnesses. But if you don't get it, in 15 years' times, we won't be asking you 7,000 rupees. We will be asking you for ventilators, we'll be asking you for dialysis machines, we'll be asking you for CT scanners. So the health budget is going to completely boom. So, of course, there are opportunities for many people in that as well, but the patients are the people who are going to suffer. So let me quickly quote this lady here. I think most of you know her. She's Kristalina Georgieva. She's the managing director of the IMF, and I will quote her word for word. She says in this particular article, the cost of full-blown debt crisis, which we are in, are not keenly felt by people, most keenly felt by people in debtor countries. According to one analysis by the World Bank, on average, poverty levels spike by 30% after a country defaults on its external obligations and remain elevated for a decade, during which infant mortality rates will rise by 13% on average, and children will face a shorter life expectancy. So, ladies and gentlemen, this is where we are. The health system needs to look at this, and what we have to do is, of course, what we are going to discuss in the next few minutes, and your role in this. So traditionally, the Sri Lankan diaspora, whoever or whatever it is, be it religious based or not, you very generously donate to us during times of crisis. You donate drugs, you donate cash. But let me tell you, ladies and gentlemen, that recently I was involved in a donation of 60 million Sri Lankan rupees worth of drugs to the Sri Lankan health system, which lasted 2 hours in our health system. So what we need to do is to find sustainable ways to change the health system. The other way the diaspora usually help us is by trying to develop our human resources. I know most of you are involved in scholarship programs, you're giving living allowances, stipends. I'm talking about the health sector and especially postgraduate work. So actually, when you do this, you really help the individuals to proceed in their career. But as I think the previous speaker also mentioned this in terms of the drug addiction, the push and pull factors and the brain drain to leave the country is so enormous that this input into human capital development for the health sector is a waste at the moment. I know this is very controversial, but this needs to be said. And I hope this is an exercise where we are here to discuss. So the traditional ways of how you get involved makes you feel good. You know, as an organization, you collected 60 million rupees, you gave us, you sponsored some scholarships for some doctors to pursue their postgraduate studies. Yeah, very good. And we are extremely thankful to you. But we need to look to the future. We need to one day, hopefully, re-immigrate your children or grandchildren back to Sri Lanka. That is the goal. That is where we want to be. We don't want to be helped by you all the time. We want to help you in your countries to develop. So please help us. Please take this into cognizance in your macro outlook, not the micro outlook, not the projects you are doing, which are excellent. I'm talking about the mindset in how you have to deal with this. So what you actually have to do is look at the social determinants of health. Why is the situation like this? What is the things which are causing the health sector to fail? What is the situation? How is education contributing towards this failure? How are the social and community contexts, if you want to talk about the Muslim community in particular? So these things are worldwide, and in Sri Lanka, we need to balance this. But nobody seems to be looking at this. Everybody is happy to do their little projects and, go on. So ladies and gentlemen, what can you do for us? So may I humbly ask you, like you helped us as a community, as a country, to come out of a policy decision which affected all of us. Please engage and assist at international and local levels in improvement and sustenance of good governance within and without the health sector in Sri Lanka to address the social determinants of health. Get the systems working. So if you are giving 60 million, or I don't know, whatever the amount, I was talking of 60 million because I was involved in that, give at least 100,000 towards organizations which are working towards systematic change, to change the systems. If not, ladies and gentlemen, all you are doing is supporting a dysfunctional system to go on and on and on. We need to rebuild this. We need your help. One day you should be proud enough to send your grandchildren, great-grandchildren, or great-great-grandchildren back to Sri Lanka so that they can live as you are living now in those countries. So help us do this. Thank you very much. I won't take any more of your time. I'm sure my thoughts have provoked a lot of thinking, and I'm happy to have any discussions if you so wish.
What an interesting and informative presentation, Dr. Ruvaiz. Personally, I could relate to so much of the information you discussed, and I think we have all learned important reasons that we need to stay healthy and fit. The statistics you gave us are phenomenal, such an eye-opener to the problems that we're facing in our country. Thank you so much. And I think having the World Forum coming on board and trying to alleviate some of these issues, I think is a great way to start. There is a question sent to me that I would like to ask you, Dr. Ruvaiz. How can the World Forum of Sri Lankan Muslims set up a system where masjids can help to overcome health for wealth, at least setting up pilot projects on help of selected masjids?
Right. So the thing is, like I said, if you take a Muslim area, I don't know, wherever you want to take, you need to, the masjid needs to coordinate that health care. For example, if we diagnose a diabetic patient, through the masjid, we can institute, I think your health project was doing something like that. So, you know, you have a system whereby you follow the patient, say you're sending him to the government hospital, what happened there? So let's leverage into our network. You know, if you come to Colombo, we are there. The Christian Federation, there's this, the Colombo Medical Faculty is right next to the bishop's house, and I know how they operate. So when a patient comes, we can get our Islamic Majlis involved, the faculty, the Mosque Federation involved, and, you know, try to follow them up through the system. And when they come out of the system, like I said, they might need help, for example, to buy some drugs. So, but this must be done in a planned way. There must be some criteria people fulfill. You can't just walk in and say, you know, give me 3,000 rupees for this month to buy the metformin or whatever. It doesn't work that way. You need, these are long-term issues. So yes, the majlis in the area is a focal point, and that will also contribute towards the previous two speakers, where you can track the people. You will know them. The mosque becomes a community center. The community center deals with health issues, welfare issues, and so on. So we could strengthen this. Yes, but the problem is you have to be, let me openly say this, I'm not, I don't think anybody will misunderstand, but the mosque, they need to work with professionals. With all due respect, you can't have the imam deciding who is going to, because going to be given this, you know, there must be a doctor in that area, other healthcare professionals, social workers who can do this. It's a good idea. Micro level, yes, good. But I was more concerned about, you know, bigger issues. For example, if you take the Christian church, I'm not comparatively talking about religions. You know, why don't we set up an organization which helps democracy in Sri Lanka, which funds, you know, across political divides, which ensures this, so that you have leverage to centers of power later on. So these are huge ideas. I think the people right up there, out there, these are the things we should be doing. We should be engaging in policy issues with these people. That is the mistake we made in the cremation issue. When they used it was a policy issue. There was nothing else. We had absolutely no access because we didn't have the correct people in the correct place at the correct time. With all due respect to the people who tried to help us at that time. Coming back to your question, yes, these types of small micro masjid federation projects, we are helping burial a lot, you know, getting postmortems done quickly, getting bodies released quickly. It's ongoing, but we could cross from the dead back to the living and try to help them control non-communicable diseases.
Thank you, Dr. Ruvaiz. I think some of the masjids actually started a program where they were asking to send in prescriptions, and they were, I think, offering to fulfill those prescriptions for the needy. And I think that's an excellent way to actually begin. There's one more question. Please suggest a sustainable plan to gear up our masjids to convert into community centers.
Yeah, this is a little outside my scope. When I say community centers, I think the people living in the Western world know. I visit UK quite a bit for work and so on. So the Muslim masjids, they have their own football field, they have their football clubs, they have their Saturday, you know, it's a real community center. But that concept traditionally has not been associated with Sri Lankan mosques. The Sri Lankan mosques are essentially religious, in the sense their only job is to impart religion. So again, it's a conceptual change we have to make. For example, why can't we hire the mosque, the community center, to have a discussion or a debate or some sort of a social event? Not happening. For social events, there are social halls. There is no integration, but Islam is a way of life, isn't it? Where you for God's sake, the Prophet lived. His house became his mosque. His house. So why can't we do this? We are separating, we are fragmenting. I'm not an expert, but that's my personal opinion.
Thank you, Dr. Ruvaiz. I think a few of us in this forum have actually tried to use the masjid for a number of projects and so on. A few masjids are open to, giving us their premises. A few aren't, but let's keep trying. Let's keep trying in the hope. I lived in Botswana where the mosques were community centers, the whole family goes and they have family events. As Mr. Shakir says, masjid can also bring awareness programs on these chronic diseases to public and make preventing measures. Yes, excellent. And there's a direct message or a comment that the women in our society need this support system. Because I think a lot of us women feel very isolated when it comes to the masjid. And if you actually analyze, Dr. Ruvaiz, yes, the masjid is full on a Friday for Jummah, but the rest of the time is actually underutilized. We have such fantastic facilities which are underutilized. We have children use of the masjids for so many youth building programs and things like that. And even for the women, I think that's really
because that's what I said. The concept in Sri Lanka is the mosque is to pray. So yes, the moment you try to even suggest something, it'll take a generation to change. So let's be the generation who started that change.
Yeah, can I, Tassie, is there any more chat, or can I give me a few minutes? Is there anybody else asking any questions?
Just one more small comment, Mr. Wahab. Educating our women is the key to bring a vital change in the long-term plans of a viable change. Yes, thank you.
Actually, if you analyze Sri Lanka's health success, there are two things which we are proud of. One is the female literacy rate, which helped control. I'm not talking about the Muslims. I'm talking about the health sector in Sri Lanka. The female literacy rate was the key thing in our successful immunization program, primary healthcare program, maternal. That's what those figures I showed you were so good. They were all women related, nothing men related. And the second one was, of course, the malaria control. So women have a huge role to play and completely underutilized.
All right. Mr. Wahab, over to you. You had a question?
All right. Okay. Just a few minutes. Thank you. First of all, let me thank Professor Rasheen Bappu and Dr. Ruvaiz for their inspirational presentation, and Brother Rashad also for something that I want to talk about and ask some question about. So let me, as far as the World Forum, while thanking you for your time and effort coming here today and to enlighten our membership as well as our participants, even though you might not see a lot of our couple of hundred people around the world, but your message and your documentation, once you give it to us, it will be sent to all our membership, so that they're all aware what action plan we'll do. So every time we have a conference, the implementation program comes in. So from today's speech, we'll pick up some points where the World Forum will discuss with the health and well-being team, right? Because we have a team headed by Dr. Ramali. So the team, we will put it to the team, the subject matter, which is about the health matter, and the other matter, the other issues of drug abuse and narcotic situation where Professor Rasheen was talking about, that we'll discuss with a special group, that we can create a special team now, since we know the issues are now facing our community and community at large. So we will discuss that. So now the point I'm going to raise now is to Professor Rasheen and to Brother Rashad. Now we are talking about a situation where the Muslim youth are not, or the Muslim community is not reporting, right, sufficiently, or we are not aware the number of Muslim youth or young adult are involved in those students, or whatever you call it, whatever the age limit from 18 to 25 or 29 or whatever. That figure is not available. As it is, we can see that I've also looked at it. There are figures available for the community, but the Muslim community ones are very low. So there are no set organization, as Professor Rasheen said and Mr. Rashad said. So before going into details, I would like to see as a world forum, since because previously, of course, Professor Rasheen, we have a discussion. I know him well. He has assisted me quite a bit during my last visit. The subject matter, I'm not an expert myself. So there are people in our world forum, there are experts who knows a little bit about these things. So I can put a team. So what I want is Rashad's information about a situation where the world forum can get involved. So could you tell us in simple, see the organizing part of it from a broad and expatriate community, how we can sort of set up in a what do you call it? I can't sort of express in words. Set up a system where World Forum can get involved, right, and see how we can best help, right? Of course, not only for Muslim, for other communities as well. But I know you have showed me quite a few places these activities are going on, but there is nothing left. So even if you, in particular, talk about the Muslim community, how best that we can get about doing it, what can be our contribution? Go to Professor Rasheen and Mr. Rashad.
Yeah, well, actually, I mean, we have the infrastructure. I mean, now say for an example, I will give you a classic example. Nida Foundation, I mean, started something very similar to this. Apparently, I mean, but they couldn't get the approval because of certain other matters. But it is good to have an individual approach. Actually, I mean, Rashad also will contribute to this. Individuals should come forward, like, what the Christian, pastors are doing separately. Even they have smaller groups, actually, about 35 to 40 members. I mean, they collect and do the treatment. And only thing is it has to be, monitored and supervised by the National Dangerous Drug Control Board. And that part actually Rashad will work on. I mean, to get the legwork will be done by Rashad. I mean, I think rest assured. I think he's actually, that is why I brought in here also for this forum, because we'll have to do the paperwork, we'll have to do the, quality assurance, all these things. We cannot just, start a, project and, embark on it and start pumping. And it is not only basically initial financing. I mean, we can charge a fee, because this is what even the Christian pastors are also doing. And they even have about 30, 40 members in a house and in a treatment center, where they charge about minimum 30,000 rupees. And even they go to the extent of charging 120,000 from per member. And there are enough philanthropies basically, even in Sri Lanka, basically to, to contribute. But only thing is Sri Lankan community, the people who are the Masjid federations, Masjid community, or, what do you call the Sri Lankan philanthropies basically don't understand the gravity of this actually, because we have other priorities at the moment, putting up mosques, beautifying it, adding amenities to this, because these are our focus. So, and the other thing is, masjids are not connected with the professionals also. That is another problem actually. We have spoken on different, areas. I have got interacted. I have got involved and, spoken different forums actually. And we have madrasas, we can use them, and we can develop them. We have to create, resource persons also. Because Rashad is the only Muslim person basically serving in the National Drug Dangerous Board actually. We have to create, as much as possible, resource persons. And there are people actually, where we can, even ACJU also does to a certain extent some counseling. And these are not effective actually. We have to do it very effectively in a very program manner. And we'll have to embark on a, result-orienting project. And we'll have to draw up a project plan and, embark on it. And we'll have to see results for ourselves. And it is not only money actually. It is basically getting the work, what do you call, out of these people at our best. So I think Rashad also can sort of contribute to this basically. Thank you.
Yeah. So what if the WSLM want to? I mean, of course, we have so many other activities that are going on, but this is something interests me, right? I can put forward to a special committee as such to form 3 or 4 people who are interested in that. The main thing is, if World Forum want to get into a situation like this or in a project of this nature, it has to be organized in a systematic manner, and then we'll have to plan out a monitoring system, right? Leave alone the funding side of it. If there is no monitoring system and the result-oriented way that we are going to do and set goals, as I was explaining more than what I should at my early speech,
Yes.
if you don't have a set goals and if you are not prepared for it, World Forum also will fail. It's not only the people who will funding will question you. People, like for example, our education project. This time when I came, I traveled northern east and Mannar district. I traveled and met all those people. We paid money to them. How they are doing, how many people are got into universities, and we were monitoring them. So I met and had a meeting with all those students who got into university. You see, so the monitoring part is very important for World Forum. So that is one. Number two, that the thing that I want to ask Rashad or yourself, whether you are aware of it, the figures and facts that you provided, is it by district, or is a general total figure that is the whole country you are giving?
I will submit basically 3 fact sheets, right? 3 reports, which basically is the latest one of 2022 from January to December 2022. After that, I mean, it has not been tabulated because the research division is working on it. So I think we can go by this, but where Muslims are concerned, basically, we cannot get a proper figure because these people are not reporting for treatment, right? But we can physically see in these areas that how this drug menace is, developing. And even masjids are also not taking any, I mean, I would say, I don't say no interest at all, but the focus has been, there's no interest on this actually, right? So they are not focusing. They start focusing, I think, I mean, we can address this.
Yeah,
You see,
Dr. Azim, sorry.
last year when I was visiting, when I was doing a small research in Colombo, in the lanes, whatever you call it, small, whatever you call it, the lanes where a lot of people live, right?
Yes.
So in those areas, we were doing a project on poverty elevation project. We are trying to find out the poverty level of those people, and we did a small way. While doing that, our people found out, the people who are entrusted with the survey and the research, they found out of that, they came across a lot of drug addicts there.
Of course.
In those areas in Colombo, plenty of them, but not reported. Only reported by the family. When we got in there to check up on their family situation, only they came out and said so and so is a drug addict or whatever, So by that way, there are a lot of people in Colombo itself. There are plenty of them.
Colombo, there are, I mean, I don't want to name this because there are enough police reports basically which I have seen to my eyes, right? I don't want to name these areas in Colombo. These are all, I mean, main Colombo areas, even in outstations, right? And it is, I mean, pathetic to, I don't mind basically opening it out in this forum. The gents basically are involved, and even women to a certain extent also they are involved. Very unfortunately, these women with their children, they get into the below poverty line, and they tend to engage in all sorts of other, matters apparently for their survival. So it is very pathetic to see, and they go to the extent of even, I don't want to mention those words. Basically, you will understand what I'm trying to say. And they have basically ended up in divorce cases. They have ended up in, what do you call, so many issues are there where this is concerned. So this needs to be addressed, and the Muslim community is affected very badly actually, because there is no, solution basically been found at the moment.
Right, okay, I'll come back to you, Professor. Once I set this up, I'll be in touch with you and we will discuss. Is there any other question, Tassie, coming up?
Yes, there is another question for you, Professor Rasheen. Who are the main people who brings drugs into Sri Lanka?
Yeah, that's a good question. Basically, I mean, well, I mean, this is coming through the fisheries folk. I think you can, You will see this in news, but very unfortunately, this is something to do. This is a policy decision government has to take. I mean, I've been also talking about it. Now you will see a huge army we have. We have 175,000 army. Now there is no war, right? But when you look at the Air Force and the Navy, the numbers are very less. Now we'll have to have a strategic shift. Actually, the defense policy has been, there is a committee being appointed to look into the defense policy. All these things have been looked into because now we don't have a ground war, actually. Now we'll have to divert these, soldiers, the naval and the Air Force basically to address this narcotic menace. So recently, India provided, not recent, about a year ago, India provided drones for COVID. And now those drones are used for, drug crime watch and crime prevention. So drug is another menace. These are interrelated. That's why I said extremism, crime, drug menace, all these are, it's a mafia actually. So it is interrelated, So now these drones have been provided, and now Air Force, basically Air Force and Navy, they are trying to procure, surveillance, helicopters and airplanes in the mid sea. And there is a extraterritorial area, which no man's land, So Navy has a problem, to intercept these things because Navy cannot go beyond that. And this is where the dealings take place at the extraterritorial, the waters, right? So now Navy is also intercepting certain things. Intelligence reports are coming. So things are happening at the moment. But we'll have to remember, if we stop the demand of intake, right? The supply also will stop. So the demand has to stop actually. It's the demand and supply, the case. As long as you consume and create a demand, right? The supplies will not stop actually. So our objective should be to prevent and educate these people, right? To stop consuming, and the repercussion of these things, how it is going to have a ripple effect on their families and how it is going to, affect their, lifestyle. Now people basically who knows the religion, there are so many, Muslim missionary groups are working. You call it all these jamaats basically, right? That jamaat, this jamaat, everything is working basically in these mosque, localities. But the Muslim community, the consumption of, drug is increasing. How is that? So that means, our dawah, our preaching is also not effective. So our focus is basically on, old age, teachings and so on and so forth. And our focus also has not basically, targeted. Even when you look at, our Friday sermons, we are talking basically, something which is sometimes, irrelevant, right? So we'll have to focus all these things. So even I think there are quite a lot of players have to get involved. Muslim Religious Cultural Affairs Department, then the ACJU, then all these missionary groups, all these things, all these people have to put pressure and start these youth, prevent consuming actually. If we start preventing, then the demand will come down automatically. So as long as there is demand, the suppliers will start supplying actually. Right? So,
and Dr. Azim Bappu,
yeah.
sorry for interrupting. I wanted to
Yes.
add up something onto this. Sorry for interrupting you. Because now in Sri Lanka, with the menace of this drug, the drug
Yes.
prevention and the drug treatment, it became a very good business. So therefore, there are people who is doing drug prevention where they don't have any qualifications, any paper qualifications, or any knowledge about it. They are very good speakers, motivational speakers. And what they do is not indirectly promoting the drugs.
Okay.
Even they doesn't know that it's happening. So without the proper knowledge of the drug, if they go to the community grassroots level, that also another problem in Sri Lanka. Even the community, they doesn't know whether these people are qualified or not, because in Sri Lanka, it's a very, very bad situation where the counseling and social work, still it's not professionalized. There is no any minimum qualifications and all. So that's the reason. So and I can make out the thought behind this question is most of our community thinks that if we able to control the supply of the drugs, it will stop. But unfortunately, it's only a one side of the coin, where the other side is demand reduction, as you say. So until and otherwise we work on both the sides, we are not able to succeed on this. Especially, but when even though the supply is there, if you're able to work on the demand reduction, definitely, as you said, we can see a growth in the menace. We can see a reduction actually.
Correct.
So
Correct.
it's very important on that case. And the other hand, in Sri Lanka, there is a challenge where there is a special act in use, which is 2007 number 54 Act, which is for the treatment and rehabilitation of drug addicts. It's a special act, and the members can go through that. It clearly mentioning the minimum standards for a treatment center to be established. So minimum standards are there. The qualifications required for the staff is available over there. So all the details available on that act, especially.
We will share it with this, forum definitely. I will share all these statistics and so on and so on.
Thank you,
And
Mr.
what you
Rashad,
said,
for that.
Rashad, yes, actually, recently one of these, I think about 2 years ago, I went as a guest speaker for one of these TOTs, train the trainers or whatever, program basically. And I found quite a lot of, counselors, basically, they were obtaining certificates through an organization which I don't want to, mention. Actually, that organization was doing, it's a huge network in Sri Lanka, but they were doing it in good faith. Very unfortunately, these counselors, they obtain the certificate and they go back and do nothing for the society, very unfortunately. So and I have seen, and they have been advertising basically in these FBs and so on and so forth, and they are doing, other counselings actually. So this is a subject on its own, and we have to give proper, basically, concentration and focus to this. And there has to be a team dedicated from the World Forum to look into it. This is my humble request basically from the World Forum for Sri Lankan Muslims. We have to, we have to get together, and we have to be very steadfast in this actually. By the time, you come back to Sri Lanka, sometimes, we will not have this Muslim community, right? So we'll have to, these people would have got perished, that is the extent, and that is the speed the drug menace is spreading at the moment. The speed is very high, right? It is not like other menace what we have. It is just lightning speed, it has gone to very great extent. Right.
Thank
so
you,
anyway,
Professor.
yeah. Okay. Thank you very much.
Brother Shakir, you had your hand raised. Do you have a question?
Yes, I was trying to contribute to what Professor Rasheen has said. In fact, I was on a holiday to Sri Lanka 2 months ago, and I saw at a mosque, OIC and some police officers comes after the Jummah sermon. They are telling the community, come forward and tell us who are the drug users. We will help them. But surprisingly, what I found from the Musallis, why this management has involved the police to come and talk after Jummah. So there is quite a lot of change has to happen in the mindset of our Musallis. The management of the masjid is trying to do something good, but unfortunately, the vast majority Muslim community is opposing that. So they are trying to do good, but unfortunately, this was not taken positively. I just want to contribute that since I had that experience in Sri Lanka in one of the mosques. Thank you.
Thank you very much.
Thank you, Brother Shakir. Brother Haseen Mohammed has his hand raised.
Yeah, no, I was listening to all the discussion about the drugs usage. Actually, I was involved with part of Sri Lanka where in my village. So there is an issue. There is a social issue. It's not just economic issue as well. Social issue. Even the guys who have enough of money, it has become a sort of fun basis. They like to go and chill out, and they're trying to do sort of a thing. So the best way that we looked at is not just programs. You need to start from home and schools and madrasas and all those people, and the community need to get involved. in any part of that part of the world, if the community is not involved, if the community doesn't think it's an issue, nothing is going to happen. Because we had this problem not now, it's 5-6 years back. We identified the issue, but the community didn't realize it's an issue. They were saying, oh yeah, I know it's a fun, guys are doing for 1 or 2 days. But now it just become a thing where even people go after school and they just go for a fun. So now it has become a community issue. Then our community is taken seriously. So the vigilante process already started. We know where the people are going, and people with the elders will go to that places. And therefore, we are trying to avoid those places for kids. And the next bit is where we also fail. So what do the kids do in a free time? What activities they have? If we don't give those activities, if we don't allow them to occupy something else, there is a greater chance, other than the social economic issue, the children will try this. That's there. So that's what we have been saying, guys, why don't we get back to the sports and other activities and open it up and the community to fund that, so that children can go away from all these things so that they can start. So now there is a pool, people have set it up. There is a badminton course. There is a cricket clubs going on, so that children have other activity. So that's what I'm saying is, rather than just we pinpoint something, identify the issues and what the community can do positively. The treatment is fine. Those things are fine. That's after the effect. But before that, how do we prevent? And that's where I'm, because we have got down the mosque, or the mosque involved. And also it's not necessarily just the mosque. There are lots of local organizations. They're willing to help. There's small charity setups. So all of them got together, and we are trying to help. So keep everything in my mind. Just it's not necessarily just a mosque. Everybody need to get involved. But mosque is a good place also, because we have a base there.
Yes. Thank you so much, Brother Haseen. Mr. Rizwan Wahab, there's a couple of messages for you in the chat addressed to me. The Muslim community lacks proper statistics and data to address the problem. We need correct information of our community, a database that should cover detailed information of our community. The World Forum can invest in coming up with enabling and processing of this data. And she goes on to say, most of the problems faced by our community is dealt with a quick fix. And the youth in this area needs motivation, guidance to look beyond growing up to be just another truck driver or a phone shop assistant. We need a sustainable long-term plan to make the change. And the World Forum has the means and the professional capacity to make this possible. We need to walk the talk. And I think that's a really lovely way to end this question and answer session. I think this was an excellent session of learning and sharing. And I thank you, everyone who had questions or comments for our panelists this afternoon. A heartfelt thank you to both our speakers, our three speakers, in fact, who have kept us interested and enthralled with their wealth of knowledge and their personal experiences. I'd just like to conclude my part with a little quotation, which I love, by James Baldwin. And he says, "Not everything that is faced can be changed, but nothing can be changed until it is faced." So to conclude our conference today with the vote of thanks, it is my pleasure to call upon the former chairman of the World Forum for Sri Lankan Muslims, Mr. A.G.A. Bari. Over to you, sir.
Hello, can you hear me?
Yes, Mr. Bari, please go ahead.
Oh, thank you so much, Tashi. Thank you. Jazakallah. Ya ilahi kareem, subhanallah, alhamdulillah, rabbil alameen, Allahumma salli wa sallim Sayyidina Muhammad wa ala ali Sayyidina Muhammad, sallam ta'ala Ibrahim wa ala ali Ibrahim, innaka Hamidun Majid. I have been given a chance to thank everyone as a former chairman. So before I could thank everyone, I should thank the people who made me to work as a chairman for the last 3 years, because the great work done by the General Assembly, the country coordinators, the team leaders, the team members, the board of management did a fantastic job with me in building up this World Forum. You know, World Forum is a gold mine. As you all seen today, the discussion, there are so much of things that we can do. How can we do? We had to get the resources all over the world. We have over 500,000 Muslims living all over the world, and they want to give back something to their country. So that is why the World Forum was launched, and it was, in fact, the concept was originated 15, 20 years ago to harness the resources and give it back. And today's discussion, we see how much things that we can do, how much things is required back at home. And as Dr. Ruvaiz Haniffa said, you know, please send your children, or think of sending your children back to Sri Lanka. And you know, no point talking about it unless you practice. Alhamdulillah, my daughter has gone. She was born in Canada. She is back in Sri Lanka, lived for 20 years, and grandchildren, her children are all back in. So as suggested by Ruvaiz Haniffa, I have started to practice, which is a good thing, and I think we should do that. Okay, now coming back to thanking the people involved. Chairman Rizwan, you have done a great job with Haji Mamta, acting, not acting now, he's Secretary General of the Forum, in organizing this AGM and conference. Because AGM and conferences are very, very essential. Unless we do that, we tell the people what you have done, we cannot progress. Because no point just doing it and not telling the people what you are, not to boast, but to sort of get them motivated. That World Forum is doing something, therefore we should help. We should be involved. We should get in, especially the expected younger generation, second generation, third generation. They should get involved too, you know. So I take this opportunity to thank Rizwan and Haji Mamta for fantastic job done in organizing this third forum and conference. Now, I should not forget the fact that Treasurer gave a very detailed report on his activities. Alhamdulillah, very important. Transparency is very important. It's one of the things I have been promoting right from the day that we started. We not only on transactions, in our thinking, our talking, our telling to people what to do, we should be transparent. We don't think something, we say we should say something else. No, openness. Because normally when you say transparency, you only talk of thinking about finance. No. Transparency in everything. Today's World Forum is progressive. We had done so well, alhamdulillah, for the last 3 years. Because we are transparent, we have one thing in our mind, to serve Allah and to serve the community. Alhamdulillah, please keep on doing a good job. And Sheikh Yasser from, he was in South Korea. I think he's gone back for the fantastic crowd. And if you look at the meaning, it says it's all do for the sake of Allah. Alhamdulillah, that is what we are doing. And we have the team leaders. My God, it is fantastic team we have. And because the way it is set up, it is standalone. They are given the full responsibility to do whatever that is good within the terms of reference, so that, you know, we serve Allah. So I should not forget Rayhana and Tasi for a great job they have done in doing a moderation. And then we come back to country chairman report, team leaders report, and then, of course, you know, there are a lot of people who did do some work behind the scene to make this conference and AGM success, like the one who designed the flyer, then Shiraz Fauz from Sri Lanka for technical help, Ubaid and other people who are sort of involved in sort of transmitting and getting these people. It's not easy organizing a virtual conference. Unlike a physical conference, it's very easy because people are there. We can talk to each other and get things done. But virtual conferences, virtual meetings are not easy. you know, may Allah reward them, may Allah give them long life, and I will keep on praying for them. That's all I can do, because the reason why I stepped down is my age. Anyway, alhamdulillah, I still assure Rizwan and Hazim that I'm there for you at any time. May Allah help all of us give it back to the community and continue to work for the community. Jazakallah. Assalamu alaikum wa rahmatullah for a very good work done. Jazakallah. Assalamu alaikum.
Adding to that, Jassi, just 1 second. My sincere thanks to Brother Bari for his support continuously for the World Forum, even though he's more or less stepped down and then retiring mode, but we call him all the time. He's still a part and parcel of. We are formed advisory council, where he will be the chairman of the advisory council. So everybody who is having a bit of a hard time to continue and to spend time, they can also still continue working with us. We don't allow anybody to go out of the World Forum. They are all still there. Even there is a scientist from India. He's 93. He's still part of the World Forum. He want to go. I didn't let him go. He's still with us, you know. Anyway, so let me thank you, Tessie, for your wonderful job you have done. I'll add to what Mr. Bari said. And to Professor Rasheen and Dr. Ruvaiz for their fantastic job. And we will keep in touch, except, in fact, I had a question for Dr. Ruvaiz. Now, of course, it's too late. I'll be writing that question to him now. Anyway, thank you, everyone. And for Hasim Hamza, for the fantastic job he has done. Now, I hope he has taken a lot of responsibility out of me now as a Secretary General. For the next couple of years, I may not be relaxing. At least, you know, I'll be there to watch and see what's going on. But majority of the work for the World Forum, now it is in his hand, right? So he will have to see the 16 teams that we have. We have just created a sports and recreation team. So he has to now get them all fit and physically fit to move on with the World Forum. Thank you, Asif, and thank you, Tessie.
Thank you, Tessie. Thank you, Dr. Ruvaiz Haniffa. Thank you, Professor Rasheen. We are good. I hope to be in Sri Lanka maybe next week, in 2 weeks' time. I will be meeting. Thank you.
I've seen you after a very long time.
Good to see you all.
We were together in the Amal International Board for a very long time. Yeah. Thank you very much.
We will meet again.
Inshallah.
I will be in 2 weeks' time in Sri Lanka.
Inshallah.
And
we must thank all the participants. You know, I think, Tessie, you must thank all the participants for their time joining us in the conference and AGM, even though we didn't get a larger number that we expected it. But we are happy with the numbers we got. All the messages will pass on. Thank you.
Assalamu alaikum warahmatullahi wabarakatuh.
Walaikum salam.